Hi everybody, my name is Amy and I'm an occupational therapy student here at the VA. I'm here today to talk to you about sensory retraining. So sensory retraining has that focus on sensory discrimination versus purely tactile input, which is the case for a lot of desensitization programs. So it's making your brain actively discriminate between different textures to try to have cortical reorganization for your sensory and motor areas of your brain. So the goal is to have your brain always making a conscious choice. Is it this or is it this? What's important with this intervention is that if your body part is too sensitive, make sure you refer to the homunculus, the body maps in your brain. And so say if you have pelvic pain, but it's too sensitive down there, then you're going to use your feet because that's the adjacent part on that brain homunculus. Another thing you could do too is say my right hand is too sensitive, then you can work on your left hand first and build your way up to that right side. So these videos, I'm going to have a couple shorter videos after this one. They're all going to go through different types of sensory discrimination. So the first one will be on 2-point discrimination, which is the assessment essentially used for all of these. Then we'll go through localization, then discriminating different textures, then stereognosis, and then graphesthesia. So a couple of shorter videos. The ultimate goal for sensory retraining is to improve sensation and reduce that perceived threat or pain. So it's really important to make sure you record your results, so the percentage correct of what they're discriminating, the stimulus that's applied, or the type of grid you're using for localization. Record the body area, and make sure you're always recording how the patient responds so that you can adapt your level of intervention, grade it up or grade it down. When you're providing homework for sensory retraining, it's important to tell your patients to engage in these exercises 3 times a day for 5 minutes. And there is a handout online for all of these exercises so that you can circle off which ones you want your patients to do. And all of these can be found in the GMI resources tool. So you want to make sure that it's the just right challenge. When you're assigning these exercises, you want the patient to be getting it right about 75% of the time. So you want it to not be too easy and you want it to not be too hard. That way they're making success and their brain is starting to reorganize those motor and sensory maps. Alright, in the next videos I will teach you each of these different interventions.